In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
I'm joined in the studio by Dr. Michael Untch, a leading breast cancer expert at the Helios Hospital in Berlin-Buch. Welcome to the show. So how common are gene mutations in breast cancer?
Thank you for inviting me first. About 5 to 10% of the breast cancer patients have a mutation, which in numbers, like for instance for Germany, just an example, I know it's an international studio, it's about 5,000 women in Germany who are affected by these genes every year. So it's a quite high number.
It's a quite high number. So should we test everybody, or especially if I'm tested positive for this gene, how high is the risk that I will develop?
Number one, we should not test everybody. We know that the first step is to ask patients or women who come to be counseled about their family history. If, for instance, there is no cancer patient in the previous family history, then the probability of a genetic component is 0. Okay. Or if a patient had breast cancer at the age of 70 and a daughter comes and wants to be tested, then also the risk is the general risk of the population. So the first step is to check for the family history. But if there is a family history, then obviously we counsel the patient or the women to have a test for BRCA1 and 2 mutation.
Yeah, and if the test turns out positive, how high is the risk for the woman to develop breast cancer over the lifespan?
So if the test turns out to be positive, then the risk to get breast cancer within the age until 80 or 90, and women today are getting quite old, is quite high. It's in the region of about 70, almost 80%. So obviously, if I would tell you that you have a 10% risk to go on the street now and have a car accident, you would say, hey, I'm not going to go on the street.
I would give away my driver license.
Correct. So that's the reason I think I understand very good women who then want to have from us an advice what to do.
And what to do? Is removing the breasts the right option to take?
Option number 1 is ask about family history. Option number 2, check for the gene test if there is a risk. Number 3, and that is the most often, the gene test is negative, then the patient or the woman who wants to be counseled can say, okay, I don't have the risk. Now, this is the nice part of it.
Right.
If the gene test turns out to be positive, so mutation, then the first advice is to sit down with the patient, to sit down with her husband or partner or family relative and sit together and counsel what to be done. What can be done is a regular checkup, like yearly at a gynecologist or with imaging, which means mammography, transvaginal ultrasound. And number 2, if the patient says, okay, I have a mutation, I have seen patients dying, in my relatives dying in my family, then obviously also the prophylactic surgery, operation, mastectomy is an alternative, which I quite understand and is accepted by many, many women.
And if I remove both breasts, is the cancer risk gone?
The risk to develop breast cancer diminishes tremendously by this prophylactic surgery, which means nothing in life is 100%, so the risk is down to maybe 1 to 2 or 3% to get breast cancer. Now, we can also talk about other risks like ovarian cancer, but the risk to get breast cancer is extremely diminished by the prophylactic surgery.
Okay. Dr. Untch, why is cervical cancer screening so important?
Cervical cancer, first of all, is a very, very spread disease all over the world, extremely like in South America, in Latin America, in the Far East. So I think it's a quite important thing to know that cervical cancer develops almost always based on so-called Hpv viruses. Now, early detection means that the patients can be saved from the very, very expensive and very time-consuming surgeries by having a simple test, taking out cells from the portion, which is the lower part of the uterus.
So this cancer is more like an infection disease?
We can say that cervical cancer is an infectious disease based on viruses. We know the viruses and we know the tests which can be done, and we know the detection method.
Yeah. So testing is one thing. Another is really preventing a disease. And for HPV viruses, there's vaccination.
Yeah. So by knowing that the disease is caused by viruses, it was obvious that the colleagues from industry were keen to develop vaccines. So at the moment, we have available vaccines which can be used in young women or young girls, and if they receive the vaccine, they are not going to get HPV virus infection, and obviously those patients or those women are not going to get cervical cancer.
That's what I do in my practice. I always vaccinate all those young girls, but this might be a funny question to a gynecologist, but what about young boys?
To be very honest, the disease is at the moment tested, or the early stages are tested in women, but the viruses are transmitted by us, by the male, by the boys. So obviously it makes sense also to vaccine young boys. And it has been done in Australia. We have a study, and it has been proven that lowering the infection in the boys is also lowering the infection in the girls. So I think in the future we will vaccinate more and more also the young boys and not just the the women, the young girls.
Yeah, when I look 15 years back, for instance, there wasn't a discussion about cancer being an infection disease. So is there anything on the horizon, if you look into the future, to learn about cancer? Are there any new tests coming up for cancer in general?
Absolutely, yes. I mean, I can look back of 25 years of profession, and like, for instance, we discovered the genes for breast cancer, BRCA1 and 2, less than 20 years ago. And the development was extreme in the last 20 years. And Angelina Jolie's example has shown that, yes, by detecting the cancer risk by BRCA1 and 2 mutation, we can also advise the patient what to do. So yes, we have a lot of tests which at the moment are done in different cancers: prostate cancer, colon cancer, ovarian cancer. And yes, I can say for the future, that is not just one disease. Cancer is not one disease. Cancer are very different diseases, and with the molecules which are discovered at the moment, we have the treatment for the future.
We need a lot of different tests for different kind of cancers.
Absolutely.
Thank you so much for being with us in the studio. Thank you.